Okay, hi everyone. Welcome to the CRM category. I'm super excited today. We're talking to Adeel Malik. He's the CEO of Clearstep. Adeel, thank you so much for taking the time to chat with me today. I really appreciate it.
Yeah, thanks for having me.
So to give a little bit more context to the audience, again, we looked at about a little over 160 what we call CRM startups. This is a lot to do with inbound and outbound patient management. And the reason why we invited Adeel today is because we're really excited about the tools that they're building, especially within inbound patient management. And we're going to go into a little bit more about those product details and what makes them unique in comparison to the other 160 companies. But before I even jump into questions, Adeel, it'd be great if we started off with that live product demo, so at least the audience has a good visual of what you guys are doing.
Yeah, absolutely. So let me share my screen and you can let me know when it comes up. All right, sweet. So, Clearstep is a care navigation solution. We help people who don't know what they need to do for care or want to be able to assess their options, get a really crisp idea of what their next steps for care should be with full transparency through the process of actually getting that care. So I'll show you what this looks like. To touch on how someone gets here to the start of this experience, we'll often have customers kind of feature Clearstep right on their homepage. So whether it's a health system like Baycare or Hartford Healthcare or a telemedicine company like Doctor on Demand, you will often be able to go directly to their website and there will be a CTA, a call to action right on the hero image that says something like, check your symptoms and find care now. And then you land into an experience like this, where I can even show you what this actually looks like for a customer. We white label the experience, powered by Clearstep, and then we'll tailor the end results to whoever the customer is. So now to jump right into the experience, I'll demo in our kind of branded experience. But it starts with a user describing their symptoms in free text. We recognize around 500 chief complaints you can answer on behalf of someone else. And as soon as the NLP engine is able to pick up what the primary symptoms are that are being complained about, we go on a 7 to maximum 14 or so question dialogue to be able to drill down into the symptoms that are actually troubling the user or the patient, to know with the highest degree of certainty what their next steps should actually be. We see that despite this being, a chat with 7 to 14 questions, we consistently see, a 90% completion rate in users actually getting to the end of the experience. So when a user does get to the end, they get a recommendation for care. In this case, you should see or talk to your doctor today. This is one of about 10 to 15 different recommendations that the user can actually get in the results view. And then what we do is we'll show fulfillment options by which you can actually see a doctor today. And in the case of ERs, we'll often just plug whatever the nearest ER is. But when there is optionality in the choice, and there are multiple things that someone can do, we show those options, we rank them, we identify what's most convenient, we show general price tags to start, but we try to get a lot more specific about it too. So in the case of virtual doctor visit here in our generic branded experience, we're just showing various virtual visit options and kind of links out to those customers' pages. When we work with, for example, a telemedicine company like Doctor on Demand, we're going to feature their kind of their care fulfillment options here in these kind of expandable options or rows. And the cool thing is when you actually click on in-person doctor visit, and you can go up here and actually it already registered my zip code. I'm in Chicago, but you can actually identify your health insurance plan. Optionally put in your member ID and date of birth, which actually I'll just quickly do to give you a sense of what this looks like. So now by putting in that information, beyond ClearStep showing me who my in-network providers are, I actually can click to see a cost breakdown, and here it's we're able to actually give a snapshot of where the user stands on their deductible, their out-of-pocket max, and what their copays will be for the various visit types that we recommend. Some of this is future state, like where we're projecting strep test and flu swab. This is stuff that kind of under development. We're actually predicting the services the doctor is likely to provide the user to give them an estimate of what the total cost of care will be. And then in the end, integrating with our partner scheduling systems to be able to allow a user to actually, book their care. We'll show the user things like specialist options as well, and can again provide some of the same functionality with cost breakdown and scheduling with those as well. And then, particularly relevant in the case when we say you can take care of this at home, and you don't really need to go seek care, we provide home care advice, relevant over-the-counter meds. In this case, things like Zyrtec to take for a runny nose or nasal allergies where your nearest pharmacy is, and other things you might want to consider, like in this case, how to make a nasal rinse for a runny nose. So this is really the technology that we're enabling. We white label this for our customers, like I showed at the beginning, health systems and insurers for the most part, but we're also working with the likes of Doctor on Demand and other large, retail health clinics. And really the idea for our customers is leverage ClearStep and the white label that we provide to be able to offer the most seamless, user-friendly, consumer-centric experience for answering all the questions that someone has when they're actually trying to find care, which are, do I need care at all? If so, what care? What's in network? How much might it cost? And when can I actually go to access that care? Or can I launch a virtual visit right now in the comfort of my home? And there are multiple kind of value levers to this for our customers that I'm sure we'll touch on. But I'm happy for the chance to have just gotten started with walking through the actual technology.
Awesome. This is really cool. I thank you so much for showing the actual step-by-step process from a user standpoint. Sure. I think that makes it a lot easier. Before I even jump into product questions, I'm just curious, is there a backstory on why you started this company and what was the rationale behind that?
Yeah, for sure. So I was always very interested in healthcare. And myself and, originally there are two co-founders of ClearStep, and we brought on two others. But myself and Bilal, who's our COO, went to undergrad together at the University of Maryland. We both did research throughout undergrad and thereafter at Johns Hopkins in the School of Medicine. And we were really, really interested in innovating in healthcare and doing new things and kind of moving the needle forward and being at the cutting edge. And while kind of Bilal went off on the track of academic medicine and went off to pursue his MD PhD, I went into healthcare consulting because I was kind of itching for a more macro level perspective on the industry. I was very fascinated by the stuff we were doing in the lab, but I wanted to understand, the macro dynamics of healthcare better. So I spent a few years doing strategy and analytics consulting at Accenture, where I got really great exposure across the healthcare ecosystem, working with biotech and pharma and health systems and payers, and then retail companies, and even near the end of my career, tech companies. And this is really what opened up my eyes. We were working with tech companies and consumer first companies that weren't historically in healthcare, but were really trying to get into healthcare. And that kind of backdrop, or that's that backdrop and that context to our work was opened my eyes up to the reality of the disruptive potential that digital had has still in healthcare. This was a few years ago, right? So, we were the topics of like AI diagnostics or AI care coordination and chat, bring chat to healthcare. Were really, were being frequently discussed with our clients that we were working with. And ultimately, I kind of realized that I didn't believe that true innovation in healthcare was going to come from really large, risk-averse healthcare companies. And I kind of recognized at a certain point that Bilal and I, within our immediate networks, we felt like we could maybe foolishly or naively felt like we could start something. We can actually be risky enough to create technology that actually could have a meaningful impact or a meaningful difference in healthcare. And so we recruited our third co-founder, David, who spent 10 years in Silicon Valley at Mozilla and Bloomberg and Dropbox most recently. Is a really brilliant engineer and was the right person we needed to actually help us build the technology, where Bilal had the clinical experience, I had industry experience, and Dave had technology experience. And we also brought on, as a fourth co-founder, our friend Peter, who's at Twitter doing sales, marketing, and design, kind of focus on the product and the user experience. But to touch on why Clearstep, why care navigation, and why this exact space, we particularly through my experiences in consulting, I have this realization that on the one hand you have payers where in unnecessary ER visits alone, with just commercially insured patients, there's a loss of $30-some billion a year, just commercially insured every year, right? And just unnecessary ER visits, not unnecessary urgent care visits or unnecessary whatever other visits, unoptimized visits with out-of-network providers. So there's a lot more waste besides even just the $30 billion a year. So you have that on the one hand. And on the other hand, you have health systems that are competing for patients. And now, not only are they competing with each other, they're competing with One Medical and Roe and all these other D2C healthcare brands, HIMSS, that are really going after the outpatient revenue of health systems. And when you take a step back and you actually look at the numbers, right, you realize that health systems alone, right, not considering private practices and clinics and other sources of care, make about $500 billion of outpatient revenue every year. And when you look at an individual health system, you realize that outpatient revenue contributes to often over half of already pretty thin profit margins, right? So people generally think it's all about the inpatient revenue, the surgeries and all that really high value procedures, which is true. That stuff is really important, but that stuff is very expensive to deliver too. And so the profit margins often are not as big as you think with those kinds of procedures. So health systems really depend on this outpatient revenue, people just kind of coming in and walking clinics because the volume of it is so much greater. And so now you have all this external competition. So you have health systems that are not digital first, not consumer centric, that are now competing with these D2C digital first consumer centric brands. And this is an existential problem for these companies that really need to be able to compete in the sphere of being consumer first. Otherwise, they risk losing a huge percentage of their business and potentially just going bankrupt. And we're kind of starting to see that happen, where health systems that aren't taking the consumer really seriously and the consumer experience really seriously are suffering relative to those that are. So that realization makes say, okay, well, there are some symptom checkers out there. There are some triage tools out there, but no one's really hitting the nail on the head in terms of really getting someone from the point of, I think I need care, to actually getting that care with transparency through the whole process, and getting the right care in the most convenient and affordable way possible. So that was a lot of the context and backdrop. And, this was 2 years ago that we started the company, a little over 2 years ago that I left my job and we started the company. And we've made a lot of progress since then in a relatively short amount of time for a healthcare SaaS company, I think. But it's always a bit longer than other companies. But that was those are some of the drivers, that the realizations through our work experiences that made us realize there really is an untapped opportunity here.
Awesome. Well, it's definitely, you might have touched on some of the questions later that I have, and I'll probably make you reiterate them.
Sure.
But, with that, from this realization, you end up going forward and creating a white label solution that that we just saw that helps with care navigation. And I'm curious, it seems like you do also have an interface that allows just anyone to come directly onto the platform without going through a partner. Why did you go to the white label route? And why specifically did you structure it this way?
Yeah. So, it's a completely different business model to be D2C and versus being B2B. And, for a relatively, for an early stage startup, you kind of just have to pick one. First of all, like I think while we do have the tool out there on our site, anyone can go use it. Although some of the functionality that I showed today is not exposed in the public facing site. But at least the basic form of figuring out what to do for care and finding some nearby care options that is available for anyone to use. We don't actively push that or market that at all. And there are a couple reasons for taking that approach and deciding on that. One is one of the more obvious, which is it's very hard to monetize a D2C symptom checking solution. Some of our competitors, or not even competitors, but similar companies, like for example, K Health, who has a symptom checker up front, they monetize it because they also have physicians that are part of the platform that will actually deliver virtual care at the end of the experience, and you pay for that, right? So there, just being the SaaS part of it, the actual software, the actual technology connector, alone, being a D2C company, it's just very hard to actually monetize that. And the amount of capital you need to actually do it is so much greater than if you just kind of focus on finding business partners. That's one kind of more. That's not the biggest reason, but that definitely contributes to everything. So relatedly, the one of the biggest reasons is that our technology has the potential to solve the real world problems of health systems and payers. They are acutely facing these problems of not having this kind of digital experience. And so by working with existing large healthcare organizations, we get a couple benefits. One, by solving their immediate problem, that's a path to revenue. I mean, you can more quickly start actually making money for the software you're delivering by not charging the user. We never charge the user. Users never pay to use our solution. We're charging the health system or the payer that's deriving the benefit from their patients or their members having this kind of digital experience. And so, you can actually sit within these bigger organizations and solve their problems. And again, related to that, you now don't have to worry as much about marketing your solution and trying to go out in the wild and get consumers who are sick to go use your solution. You can leverage the brand of your partners who have already done a lot of that work. And so, there's data out there like Rock Health, consumer, I forget what it's called, like the consumer satisfaction report, or consumer experience report that they publish every year. Most recently was just this last December, so probably another one coming up in a few months. But it was interesting that last report showed kind of this like index of like consumer trust in healthcare. Like what kinds of companies do consumers put their trust in for their healthcare? And like provider organizations were like by far the most trustworthy from the lens of the consumer. Payers, there was a big drop off, and tech companies, there was an even bigger drop off. So consumers, the average consumer is like not that willing to trust your kind of random tech company, at least in their eyes, a random tech company with guidance for healthcare. But when it's, Baycare Health, one of the biggest health systems in Florida, that personally, or when it's Hartford Healthcare, or when it's Doctor on Demand, or when it's CVS or whoever it is, like brands that you can trust, United Healthcare, you're more likely to engage with the solution when it is marketed by that organization. So those are some of the layers to why B2B white labeled solution versus direct to consumer.
Gotcha. And you kind of touched on a little bit of the next question, but care navigation is an issue, and especially as a patient, it seems, or as an individual, when you feel sick, there's a lot of different outlets. And one is your Google search, what's wrong with me? And then you can go to media content. The other is you can go to the fee-based telemedicine services. There's a clinic down the street. You can walk into to a meeting with your physician. And so I'm curious, for you in your position, why, when companies are partnering with you to launch your platform as that interface for themselves for care navigation, why did they go this route? And is this their just way of competing with the noise that the consumer already has and just trying to offer that experience that's more seamless?
Yeah, I mean, it's a good question, right? There are many avenues, and oftentimes people aren't thinking, I need care. I'm going to go to the health system's website and figure out what to do. It's like, let me just search my symptoms on Google, which is a very common kind of entry point. So why are our customers actually pursuing licensing or adopting solutions like ours? I think right now, the innovative players in the healthcare ecosystem are recognizing just the value in, like you said, competing with a digital solution. Just right now, it's like, even if I can't articulate that, as a customer saying, I can't articulate the super clear ROI, which is there, right? Of like, oh, this could be a lead generator, this could bring in more of the right kind of people to the healthcare system. It's like, just by us having this kind of digital solution out there to be able to offer people a means to find the right care is super appealing to health systems, particularly, and it provides a new channel to be able to get patients through the door, right? So, for example, like you mentioned, Google search. One of the avenues we are exploring with partners is them placing ads on Google, placing Google ads on symptom searches in their geographies, right? So that when people search their symptoms, they see actually placement for, our partner's white labeled Clearstep solution. When they click on it and go through, they're going to be featured options within that healthcare ecosystem, right? So, generally speaking, from the health system perspective, there are two main value levers: the user experience and consumer experience alone, which is what we spent some time on, and then two, the ability to have a new channel into care, into the health system that is probably the cleanest channel into care, into knowing what your actual options are, and seeing availabilities and things like that. So an actual kind of lead generation kind of angle is the second and potentially bigger value prop.
Okay. Awesome. Well, I on the technical side of things, how did you collect this data? And when you showed us that pipeline of, you can now enter your patient information, you can see the doctors that exist, you can even see the price per service. How did you do this? How's it possible?
Yeah. So some of it, like the price, the robust price transparency stuff is still under development. So, but I'll touch on it. So basically the first piece, which is the triage algorithms, we partnered with, some of the original writers of triage algorithms, that are out there, right? So, Dr. Thompson, David Thompson, and Dr. Barton Schmidt kind of wrote the original triage protocols that are used in virtually all nurse call centers across the country today. And via basically some connections that we had, we were able to get in touch and work with them to be able to leverage some of these authored protocols into the Clearstep experience, which has been tremendously beneficial for the company, because it gave us such a quick leg up into really clinically validated content that our partners already trusted. So that was really big, kind of striking those partnerships early to get access to the exact kind of data we needed to build triage algorithms digitally, right? So that was a big leg up initially. And then, the provider data that we feature, we have our own third-party sources where we can bring provider data in if the health system isn't able to give us access to theirs. But generally, it would come from two. So either we bring our own to the table, which is less preferred typically, right? We would rather the organization we're working with open up their provider directories or their provider data to us to be able to leverage. So that's coming often directly from the customer. And then scheduling is the same, right? We are very bound when it comes to scheduling. We need to work very closely with our partners to be able to enable online scheduling. But things like being on Epic's App Orchard really help to make it easy for health systems that are running open scheduling on Epic to be able to read and write into scheduling systems. And then the price transparency stuff, we have a partner to do, that we're integrated with on the back end to do the actual eligibility checks and kind of check what copays are and where people stand on their insurance. But the kind of price transparency model that we're building is kind of, our proprietary data models that we're building, kind of a predictive model to be able to predict when someone complains about X, Y, and Z symptoms, what are the services the doc's likely to provide, and then how much might those services actually cost the user. So, there are a lot of data sources kind of coming together for this experience, right? It's like 4 or 5 at least pretty complex data sources that we're kind of marrying together into something that just feels like a really intuitive, easy to use, self-explanatory user experience. And we take a lot of pride in that, turning that complexity into simplicity for the actual user.
Okay. And I think you already kind of highlighted it in this question, or your most recent answer, but care is super broad. It feels like in some instances, it's really hard to narrow down for a lot of individuals who might, whether it's the type of symptoms they're experiencing or the things that they're looking for. How did you said you worked, you highlighted it already, but how do you manage taking such a lofty goal of trying to filter out what patients and where they should be routed to when it seems like the options are so vast, and at the same time you have so many different ways patients would communicate with you. It seems like it's such a daunting problem. And how did you manage that, especially with what you showed us earlier, where not only you've figured out whether the options afterwards, what they should do, but you even provide recommendations of what they can do at home and how you connected that. I mean, it's really impressive. So I'm just curious how you manage this.
I think this question is like the core of what the problem is that we're solving, right? It's that, like, I previously, when I was describing the problem, I was focusing more on the business problem before, but this is the exact consumer problem that we're all extremely familiar with. And it's really the marriage of this consumer problem and that industry problem that birthed Clearstep as kind of sitting right in between those two, to make it much easier for consumers to navigate that. You're right; it's super confusing. It's very unclear. If I wake up with pretty bad stomach pain, is this something I can go to the Minute Clinic for, the Walgreens clinic, or do I need to go to the ER, or something in between, right? Like this is a very common problem that people are facing with. So I think the partnerships that I highlighted have been critical to do it, not reinventing the wheel where you don't have to. The clinical, a lot of what you're describing as the problem here is the ambiguity in what is clinically the most appropriate thing to do, right? Like, we're not doctors. We don't, the average person doesn't really know. They're not trained to know what exactly to do, and they don't have access to a doctor to be able to ask on text. So the reality is, though, that this clinical logic has been, evolving and baked for thousands of years, like actually thousands of years. And it's all in the heads of clinicians. So it's really like, how do we take that out, and how can we build partnerships where we aren't reinventing the wheel and just trying to do that from scratch, because that knowledge exists. It's about how do you capture that and deliver it to the user or to the average person in the easiest way possible. And I think that's what we've focused on early on in building the company, right? And in the first, year and a half of building the company, we were really focused on just that, like building technology and an interface that is able to go from here's what's wrong with me to what are the viable clinical options for care. Because that's the basic question we're answering, right? And the recommendations we're giving. What is clinically appropriate? That's what we're ranking there. And then from there, it's the home care advice stuff that, again, like for every symptom you could ever complain about, there are textbooks of here's what you should do. Here are the relevant over the counter medicines. Here's home care advice. So we took an approach of building our own stuff where we thought we could create real differentiation, and partnering where we thought knowledge already existed. And I think that's pretty important for healthcare startups in particular to realize that, focus on where you are very differentiated, but like, don't try to do everything yourself because it's going to be very overwhelming to actually deliver a solution for it. Hopefully that helps answer the question.
Yeah. No, and I think you even part of that question too, you answered in the beginning where you started with working with the partners who are the original. I can't repeat their names because I already forgot. I'm terrible with names.
Sure.
But the original individuals that built out the triage algorithms to route patients in the beginning. And you said that this is already what was used in most nursing centers prior to this, evolution of digital interface. And so, and using that, I guess, as your starting point and building off of that in a more user-friendly way, but also something that can expand in a lot of different directions is smart.
Yeah, no, I appreciate it. Yeah, we got lucky.
Yeah. Well, and I maybe for context for the audience about why this is such a big deal from working directly with the partners that you have today is previous to a company like yourself building out this care navigation platform, what did patients have before this as a means of have an issue? How did they originally figure this problem out?
Yeah, it's probably still the most common thing that people do, right? WebMD, like, Google search WebMD. Or you're lucky enough to have someone in healthcare in your immediate family, and that's your go-to, right? Like I was personally lucky enough that my dad is an ER doc, so my whole life, like I called my dad if I ever needed anything. So it's partly is that realization, right? Like I'm very lucky to have that. Not that many people have that, and so this is like Clearstep becomes the speed dial of like what my dad offered to me my whole life. For everyone, of like here's a much more curated way to access information for what to do for care versus like navigating encyclopedias of information online, because that's what people did, right? They search their symptoms, and the onus goes to a person like you or me to have to like sift through all this information on like headache and be like, what is relevant to me and like my headache and what's going on with me and when it started and all this kind of stuff. It's like we've kind of shifted that onus where we're going to take care of that. All you got to do is answer our questions, right? But that's what people did, right? They not and because of that very that experience with so much friction is why we see all the wasted spend on the payer side, all the missed opportunities to deliver the actual right care at the right time for the health system. So it hasn't changed yet, right? Like we're still kind of up against that, right? It's still WebMD gets how much traffic a month, right? I'm not sure off the top of my head right now, but there's still a lot of people going to these sources for guidance on care that aren't really the best for delivering what they actually need.
And I guess also there was no way for your partners to communicate guidance because it's not like they are content producers. They couldn't necessarily have that interface to talk with anybody. So it was just, are they going to show up at your clinic or are they not?
Right. Or, they have like provider directory pages, right? You can go on a health system and just be like, here's a list of all the docs and here's a list of all the facilities. And like, that's the best that they have, right? So that's changing. Yeah.
One of the things that we liked, why again highlighted you as a part of one of the top CRM companies within globally, was we were pretty impressed with the features that you're building on top of this. It's not just care triage and navigating patients, but you're adding in some cases, you're adding medical content, which you talked about before, things like what you can do at home. You're matching people with the right providers, the right location, especially being in the US, showing the transparency and how much something would cost and what would come out of your pocket based on your insurance is extremely important in current healthcare setting. I guess what for you do you think for a lot of patients or individuals, what do you think what are the features that they're most excited about across all the offerings that you have?
Yeah. Well, I think even just in the core virtual triage experience or symptom checking experience, I think we get a lot of user feedback. We get, we measure NPS scores, we get user feedback in free form back, and we monitor this, and we see just a lot of people commenting on just how simple and intuitive the experience was going from here's what's bothering me to here are options to care. So I think just that alone is solving a lot of problems for consumers. However, like you pointed out, we are not stopping there at all. And we believe that that initial triage is simply not enough to actually unlock the value of care navigation technology. The real value is unlocked when you can actually get someone to care, when you can, actually fulfill demands for the service, right? Offer the care, not just directional guidance as to here's what you might do and here's what your options are, but launch the virtual visit or book the appointment, right? Like that's where you start to really unlock real value. And that's what we're building towards. So the stuff in between, like matching you to the right provider and estimating price is really important towards getting more people actually to the right care and fulfilling the actual demand for the service, right? So that, like, I think is our approach of recognizing that the initial triage is where we started, but it's not enough, and we have to do a lot more to unlock real value for the consumer and the business, so on both sides. But to answer one of your other questions too, of like what are people most excited about? I mentioned the triage, but the price transparency stuff is really exciting to us internally as well, right? Like we've seen in initial user testing how much people are like surprised at like the ability to even get this information up front, right? And so we think, as we build for more and more robust price transparency, it could become really the entire new frontier, right? So for example, like right now, imagine you're a Clearstep user and you went to Clearstep because you actually had symptoms and you didn't know what to do. And we recommend urgent care and we tell you how much it'll be. We say $150 out of pocket projected, and you actually go and it actually is $150 out of pocket. And that's what you paid. Like you're kind of bought in for life, right? Anytime you have symptoms, your kids have symptoms, your parents have symptoms, you're going to be like, go use this tool, because not only will you get guidance on what the right options are, you will know how much it will cost, right? And so now as we further and further price transparency, it's really exciting because, we think that it will be the reason why people come back and even use the tool to begin with. Whereas now, even if you'll get a price projection, even if you think what you want to do. I already know I want to go to the retail clinic. I already know I'm going to go to urgent care or do whatever it is, but I'm going to use this tool because, it'll give me a price projection as well. And I might see other options available to me too, right? So I think price transparency is going to be kind of the next big frontier for Clearstep to really aggressively pursue.
Gotcha. Well, I'm curious I'll throw a couple questions at you at the same time. Are you working more with payers or providers, and what does that business model look like? And at the same time, how much of when working with the payer or provider or whoever you might be your partners, how easy is implementation? Is there a lot of hand holding? Is this a system where they just don't even have to worry about and it takes care of itself and they can just be happy with the care navigation and trust you with their patients? And so curious to get your thoughts on these three questions.
Yeah, so we're working with both health systems and payers. we are a bit more focused on the provider side. However, we are working with some big names on the payer side as well. When it comes to implementation, to get the kind of initial white labeled version with just some basic configurations into your provider data and your facility information and your virtual visit information is a really, really quick process. We take 2 weeks really from the point of signing a contract to having something production ready for our customers, because of the fact that we've done the development. We handle getting it production ready on our side, right? We just need them to give us some basic information that we kind of bake into our agreements. And so this is, it's something that makes Clearstep really compelling, I think, to our customers, right? They know that if they want to just start moving this direction, right? They don't want to enable the price transparency off the bat. They don't want to do the scheduling integration. They just want to get something out there that can help direct people to the right point of care in their ecosystem. That process is really quick, and we share all that data back to our customers. We have really, really nice, really beautiful, like live, real-time, web-based dashboards where you can go in and download data and see trends over time, see what people are searching, and see what triage recommendations are being generated, and see what people are clicking on, and what whether they're proceeding to actually go to the page, like book the appointment, things like that. So we're sharing all that data back, and so it's really appealing to our customers to say, give us this information. We'll give you a link. Just create a button on your page, and here's some best practices we've seen from other customers in terms of how to market this in the first few weeks, right? And how to really start funneling people towards it. So we do help with that a little bit too, and in terms of here's our perspective. Here's what we've seen has worked with other customers. So that's to get it off the ground. Now, to do some of the additional layers of getting really specific with in-network providers and actually plugging into the scheduling system, those are a bit of bigger lists, right? But the point is that to get Clearstep off the ground doesn't require that stuff. And so you can immediately, sign a contract 2 weeks later, put something up, and now we can work together to make it even more actionable. And I think we often recommend this approach to health systems who maybe are eager to do the whole thing, go all the way into scheduling. And we kind of recommend, like, let's take an incremental approach here, because you'll learn things, we'll learn things, and we can kind of take a bit of a longer path towards the more holistic solution. So, yeah.
Awesome. Quick question. Do you have a hard stop in 7 minutes, or is it okay we go a little bit over?
We can go a little bit over.
Okay, because I have a couple questions that I think are important, sure. And then I want to also end on a solid takeaway item from you.
Sure.
One is, are there any limitations or risks with the platform that you have, especially for care navigation? And then also a kind of a break off that's unrelated to the question I just asked, but related to the last question I asked, is it feels like it's really tough to sell directly to providers or payers. And a lot of people, especially health IT, seems to have such a long sales cycle. Yeah. So how have you been able to navigate that?
Yeah, in terms of risks, right? Like, people often think there's potentially like diagnostic risk or risk of kind of like having to hold the same kind of medical liability insurance that like a doctor would have to. I mean, that's not the case. The FDA kind of categorizes solutions like ours as patient decision support tools, and so those are not regulated by the FDA. There are certain criteria you have to meet to be categorized in this way, but as long as you don't basically make it feel like to the consumer that they are receiving a diagnosis from your solution, and rather it's a data-driven tool to help them make a decision for care, then you're kind of exempt from FDA regulation. And obviously there still are insurance requirements, but they're not nearly what they would have to be if you were categorized as a diagnostic tool. So there's from our view very little risk in enabling a solution like Clearstep, especially when you can trust that the original content source is so clinically validated, and is so accurate and demonstrably accurate. And we have a lot of data to support that. So yeah, in terms of sales cycle and getting your foot in the door at big organizations, you're right. It's super hard, right? Like it took us some time. Like we had some early partners. We did strike an initial customer pretty early on, and we deployed, although it wasn't the exact right type of customer, and utilization wasn't that great. And then we implemented with a small startup to be able to get user data, but in getting some initial data of how people are interacting with your platform, we would run kind of D2C kind of Google ad campaigns just to get the data through, which was super informative both for user testing as well as to kind of show investors and other customers, like, here's what we're seeing of how people are interacting with the solution. So getting some initial data to be able to suggest what your value is and how people interact with your solution is super important. But then with health systems too, it's really important to have credibility, like, and trust in terms of, especially with, like you pointed out, care navigation solution that is like a kind of clinical tool or involves like clinical logic. So again, the partnerships that we struck early on have been very, very helpful for that, to build that level of trust with our partners. So there's a variety of factors, right? For us too, what really helps was, we went through the United Healthcare Techstars Accelerator last fall. The second cohort just started. I think like this week or last week. So around this time last year, we kind of, the team moved out to Minneapolis, and we were working full time, basically out at the headquarters of United Healthcare. And so that was really helpful for us as well, where it was even at minimum, it was just some brand equity that we had as being part of that program. And it helped to then start getting in front of more healthcare organizations to have some of that credibility. It's not easy. There isn't a one size fits all solution for how to get in front of health systems and actually kind of beat the sales cycle here. We also, COVID was a big tailwind for us as well, right? Like we were in contracting cycles with a couple organizations that got like dramatically accelerated as soon as COVID started, because people, our customers and health organizations acutely recognized the need for better ways to digitally route people to the right care, right? They really didn't want people coming to the hospital who didn't need to be there, and they really wanted people who could just use a telemedicine visit to do that at home, right? Mm-hmm. So that's, we were enabling that. Right. So that was another thing that we had absolutely no control over. Of course, that was a huge tailwind for the company and facilitated a ton of growth this year. And we don't think that was like a spike that and we're seeing that it wasn't. We have pretty sustained projected growth where that indicates that this was more a paradigm shift of kind of healthcare organizations behavior and perspective on care navigation solutions. So, that was totally out of our control. Definitely can't say that everyone can count on macro events completely changing the trajectory of their company. But, we were very fortunate to be in a position to deliver value in a really difficult time.
Yeah, it's definitely, it's interesting to see how a lot of, especially healthcare companies, have adjusted to the pandemic. I have last question, then we'll go to closing, because I know we're at the end of the time here. What do you think is the future of healthcare, especially for care navigation, or what I call the CRM category? And what do you see that most people don't?
Yeah, it's a good question. So, right now, I think we're still focused on just like getting the transaction right? Like getting the transaction from I need care to what's the right care for me. And just like that experience right now is so broken that we're just trying to fix that. But the future of healthcare is not transactional like that. It's like relational, and it's facilitating a better long-term relationship between provider and patient. And And so we think that a solution like ours can fit really well in that paradigm as well. Like, even though we're facilitating that initial match, the way that we see that our product can expand and grow is longitudinal care management, care coordination via chat, like facilitating, more touch points between the provider and the patient in an automated way that helps deliver really complex information to the user in a really easy to digest way and really actionable way. And then that information getting shared back to the provider, and really just facilitating a relational bridge between the two. That isn't just, I need care. How much is this going to cost me? Cool, I'll book this appointment. Like, it should be much more robust and much more robust than that. So broadly, I think that is where healthcare is going, and specifically when it comes to like care navigation and access to care solutions. What do we know that others don't? I mean, I think that we're just kind of ahead of the curve right now, right? Like, we have, 2 years ago, we're successfully kind of predicting where the industry would go and what kind of partnerships we needed to be able to get there, and what kind of clinical foundation we needed to build. And now I think we are better positioned with, better clinical logic, better kind of a better, more robust end-to-end platform that we can use to keep building towards the future. So, I think, again, like, just to reiterate the first stuff that I was saying, I think we are positioned to actually drive forward that kind of change in healthcare, to make it go beyond this transactional experience to this broader relational experience, facilitating more than just initial access to care, and broader care coordination. So that's our perspective.
Awesome. Well, I thank you so much for staying a little bit over time with that. That was basically everything I wanted to go through. So this was fantastic. Thank you so much. Did you have any, before I close out, did you have any other closing remarks, asks from the audience, anything that you want to mention?
Hey, the last thing that I guess I'll say is just, a pitch out to any healthcare organizations that didn't necessarily think that digitization or consumerization or this kind of access to care solution was really important until recently. We would love to work with you. We're also hiring. So, product engineers, get in touch. We would love to hear from you to build the future of healthcare together. So yeah, appreciate the opportunity to be on. Thanks for having me.
Thanks, Adeel. And it was, like I said, it was great to get your perspective on not only the background of the product, how that fits in to this complexity of managing the provider, the payer, and the patient relationship, and then going through a complex process of figuring out what's wrong. And we highlighted you because we thought your platform was unique. It was straightforward. I'm happy that we got to sit down and chat, because now the audience, I think, has a true in-depth understanding about why now it's important, and also why companies like Clearstep are the #1 companies in this category, and why, for example, providers or payers probably should be working with you. So this was awesome. Thank you so much, Adeel, for your time. I really appreciate it.
Appreciate it, Kyle. Thanks so much again for having us.